Beyond. That's where we go every day at Ralph H. Johnson VA Medical Center. Beyond medicine, beyond research, beyond healthcare.
We started receiving heavy fire. I remember the hit. I remember waking up on the ground, and that's when I felt my hand was, something was wrong with my hand. The pain was extreme. Pain medicine they were giving me wasn't even working.
He had had multiple surgical procedures throughout his many years post-injury. He was living with an extremity that was not functional.
I was actually picking my son up to put him inside the truck, and I broke 8 different spots in my hand and up into my forearm.
They were looking at doing an elective transradial amputation on his left forearm.
And so in 2018, I had my final surgery, and that was to amputate my left hand.
I had asked them to do a consult to mental health to have him meet with a provider just to make sure that he was set on this. Having a team approach makes sure that everybody is on the same page, and it's a better outcome for the patients.
Since the amputation, I'm pretty much unstoppable.
His milestones have been astronomical.
I like to think now I'm stronger and better than I was.
There was a staff sergeant, and he just forced his way into my room.
Many people are reluctant to disclose incidents of military sexual trauma. Our estimates are that 1 in 6 women have been impacted by either chronic sexual harassment or sexual assault, and 1 in 100 men.
There is a big stigma about coming out about trauma or anything like that, and most people don't talk about it.
All veterans who come in for their initial primary care appointments are asked whether they've had experiences of military sexual trauma, including chronic sexual harassment or sexual assault.
In the intake question period, they asked me if I had experienced any MST. And because I said yes, it was a trigger in the system.
People compare it to incest in the family because you gotta think about the military culture where you're trained to have each other's back.
The people that I'm supposed to trust is not who I can trust.
We've been doing telehealth for a number of years now, and it's been shown just as effective as seeing a veteran in person. It's easy for veterans to use telemental health.
Oh, I'm so grateful for telemental health. That means I can stay and get my life done and take care of my family.
It's about extending that care into their everyday lives.
When I heard that diagnosis, it was like they dropped a big bomb on you. It's like, is there a life after this?
We know that veterans are more likely than those in the general population to be diagnosed with lung cancer, the #1 cancer killer of our veterans.
They took the cancer out, and then I started with my treatments after that.
The ability to meet with multiple specialists in one day improves the timeliness to care. I think that the patients get the best care, and it's the right thing to do.
It was a team that did it, even down to my triage doctor. These are quality doctors they have here, and they got quality service here.
We really have experts in all aspects of lung cancer care, from early detection to advanced diagnostics, as well as advanced therapies for stage 3 and stage 4 lung cancer.
This is the best VA center that I've ever been to that gives you all the treatment that you need.
When we're able to usher someone through and get them cancer-free, it's a wonderful feeling for the doctors and for the patients, for their families.
I drive, I do everything in the world I need to. I'm 72 years old, and I really enjoy life.
What I have is a disease, it's called disease of addiction. From 1995 to 2010, I was in and out of penitentiary. That's when the homelessness started.
We have over 600 veterans that are unstably housed that receive primary care and mental health services through HPACT, which is the Homeless Patient Aligned Care Team.
My rock bottom came, I was sitting outside of a store one morning, and I had a hernia. A guy I used to get high with, he said, "Hey man, ain't you a veteran? I mean, you need to go register at the VA." That's when I found out about the program here.
The veterans come into the homeless program, they get primary care needs met, they get their social work needs met, their substance use, their legal needs.
The care's been outstanding. My doctor's good, my team is good.
Veterans are so appreciative of the care you give, and you're meeting someone at their lowest point.
VA was a godsend. Since I've been here, you know, a lot of firsts in my life. First time home buyer, I never thought I'd ever own a home. I ain't no role model. I'm just Alexander trying to do the right thing.
I was in the area where the highest concentration of Agent Orange was ever used during the whole war.
In part because of that, Joe's had premature high blood pressure and premature artery disease in his heart.
There's no family history of heart disease, yet I had this first heart attack. It was shortly after that first heart attack that I met Dr. Zile.
He was one of the guys who was a gregarious, enthusiastic guy.
I had no idea he was a physician, much less a cardiologist. And he said, you know, if you ever want a second opinion, let me know.
Joe began to have symptoms of chest discomfort.
It was a Sunday morning. I came in the hospital. They sent me to the cath lab, determined I was in trouble.
We defined his coronary arteries and said, this man needs coronary bypass surgery. He goes to the operating room, they begin to anesthetize him, and he has a cardiac arrest.
And this young surgeon manually massaged my heart until they could get me on the heart-lung machine and try to bring me back.
They bypassed his arteries, they took him off the heart-lung machine, heart restarted, he woke up, he went through a normal post-operative course, back out hunting and fishing in 3 weeks.
If it wasn't for Dr. Zile and the VA, I would not be here. My grandchildren wouldn't have a grandfather. My wife wouldn't have a husband. There's no doubt in my mind.
So I've gotten to know Joe now over about 25 years. He's become a very close friend.
Well, he calls me every Thursday, and it means a lot to me.
You have the privilege to be able to provide that extra layer of care.
He knows I love him like a brother. He can fix hearts. I can fix anything else. So we make a great team.
Beyond all expectations, Ralph H. Johnson VA Medical Center.